morning, Dr. Moore.
Good morning.
So you've just received your second dose of an mRNA vaccine, and your first dose was Pfizer, and your second was Moderna. Is there any concerns the community should have?
The community should have no concerns about this. The mRNA vaccines are interchangeable. The active ingredient of the vaccine, the mRNA, codes for essentially the same protein. So people should have the same response with either of the mRNA vaccines or interchanging the mRNA vaccines.
And is there any advice you give our community members about getting their second dose?
So the advice I would recommend for folks is to receive the second dose, so the soonest second dose that they can get, especially with the Delta variant around in the community. We really want folks 2-dose immunized as soon as possible so we can really have that 2-dose summer.
And once they receive their second dose, what should they do right afterwards? Should they continue to follow public health measures?
People should continue to follow public health measures after receiving the second dose. We know that immunity only gets to a good level after 14 days after your second dose. So if you kind of go around a day after the second dose, it's not actually reached its full effect yet. So the full effect is 14 days after, and I would continue to recommend for folks to follow public health measures.
Okay, and could you tell us who is eligible and when will the community be eligible for their second dose?
So by June 28th, all adults 18 and over will be eligible for their second dose of the COVID-19 vaccine. Currently supplies are limited, and with the Pfizer delays, appointments are also very limited. However, we do expect more Moderna and Pfizer to arrive by next week. So hopefully towards the end of this week into next week, we can open up many more appointments. So again, I'd just like to thank the community for getting immunized. Immunizations are safe, they're effective, and it's probably one of the best things we can do right now to prevent the spread of COVID and to really to get back to normal.
Thanks very much, Dr. Guan.
Thank you.